Welcome to our video, where we'll be talking about an important topic that affects millions of people around the world. Heart health. Heart disease is one of the leading causes of death globally, and it's crucial that we take steps to protect ourselves. In this video, we'll be discussing 8 leading causes of heart disease and heart attacks. By understanding these causes, we can take action to prevent heart disease and lead a healthier life. So sit back, and let's dive in. Firstly, smoking. This is one of the leading causes of heart disease and heart attacks. The chemicals in tobacco smoke, such as nicotine and carbon monoxide, can damage the heart and blood vessels. Nicotine can narrow the blood vessels and increase blood pressure, making it harder for blood to flow. And carbon monoxide decreases the amount of oxygen that can be carried in the blood, which can damage the heart and blood vessels. Over time, the damage caused by smoking can lead to the formation of plaque in the arteries, which can block blood flow and increase the risk of a heart attack. In addition to these immediate effects, smoking also increases the risk of long-term damage to the heart and blood vessels. As an example, smoking increases the risk of atherosclerosis, a condition in which the arteries become narrow and clogged with plaque, reducing blood flow to the heart. This can increase the risk of heart attack, stroke, and other cardiovascular problems. In addition, smoking can also weaken the walls of the blood vessels, making them more prone to damage. Therefore, quitting smoking is one of the best ways to reduce the risk of heart disease and heart attacks and improve overall heart health. Second on our list is a poor diet, another cause that can significantly increase the risk of heart disease and heart attacks. A diet high in unhealthy fats, such as trans and saturated fats, can raise cholesterol levels, increase inflammation, and contribute to the buildup of plaque in the arteries. In addition, a diet high in sugar can lead to weight gain and an increased risk of type 2 diabetes, and a diet high in salt can also increase blood pressure, all of which are risk factors for heart disease and heart attacks. Furthermore, a diet rich in vegetables, whole grains, fruits, lean proteins, and healthy fats can help lower the risk. For example, foods high in fiber can help lower cholesterol levels, while foods rich in antioxidants, such as berries and leafy greens, can help reduce inflammation and protect the heart. In summary, it is important to maintain a balanced and healthy diet. This includes limiting the consumption of unhealthy fats, sugar, and salt, and increasing the consumption of fruits, vegetables, whole grains, lean proteins, and healthy fats. Third is physical inactivity. This is a major risk factor for heart disease and heart attacks. When you are physically inactive, your heart doesn't get the exercise it needs to stay healthy and strong. This can lead to a decline in cardiovascular fitness. Physical inactivity also contributes to a number of other health problems that increase the risk of heart disease and heart attacks, such as obesity, high blood pressure, and high cholesterol. In addition, a sedentary lifestyle can also lead to insulin resistance, which can increase the risk of type 2 diabetes and heart disease. On the other hand, regular physical activity can help lower the risk of heart disease and heart attacks by improving cardiovascular fitness, lowering blood pressure, reducing cholesterol levels, and maintaining a healthy weight. Physical activity can also reduce stress and improve sleep, both of which are important for heart health. Research recommends at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise per week, along with 2 days of strength training. However, even moderate amounts of physical activity, such as a 30-minute walk each day, can have a positive impact on heart health. Therefore, it is important to incorporate physical activity into your daily routine to maintain a healthy heart. If you're enjoying this video, don't forget to subscribe to our channel. By subscribing to our channel, you'll also be supporting us in our mission to create high-quality content that can help you improve your life and well-being. In addition, keep watching the video until the end, as you won't want to miss out on some interesting facts about alcohol consumption. Fourth is stress. Stress is a well-known risk factor for heart disease and heart attacks. Chronic stress can lead to a number of physiological changes that increase the risk, including increased heart rate, elevated blood pressure, and increased levels of inflammation in the body. When you experience stress, your body releases stress hormones, such as cortisol and adrenaline, which can cause your heart to beat faster and your blood vessels to narrow. This can increase blood pressure and make it more difficult for blood to flow. Chronic stress can also affect the immune system and increase inflammation in the body. In addition, stress can also lead to unhealthy behaviors, such as overeating, smoking, and drinking alcohol, all of which can increase the risk of heart disease and heart attacks. It is important to explore healthy ways for stress management, such as having regular exercise, meditation, deep breathing, and talking to a friend or therapist. Furthermore, finding ways to reduce stress in your daily life, such as managing your time more effectively and setting boundaries, can also help reduce the risk. In conclusion, introducing healthy ways to manage stress and reducing stress in your daily life can help improve heart health and reduce the risk of heart disease and heart attacks. Fifth is obesity. This is a major risk factor for heart disease and heart attacks. Being obese or overweight can increase the risk of heart disease and heart attacks by contributing to a number of health problems, such as high blood pressure, high cholesterol, and type 2 diabetes. Excess body weight, especially around the waist, can also increase inflammation in the body and make it more difficult for the heart to pump blood. Additionally, obesity can also increase the risk of sleep apnea, a condition in which breathing stops and starts repeatedly during sleep, which can strain the heart and increase the risk of heart disease and heart attacks. On the other hand, maintaining a healthy weight through a combination of regular physical activity and a balanced healthy diet can help reduce your risk. In conclusion, maintaining a healthy weight is an important aspect of heart health and can help reduce the risk of heart disease and heart attacks. Sixth is a diet high in saturated and trans fats. This can increase the risk of heart disease and heart attacks by contributing to high cholesterol levels. Saturated and trans fats are commonly found in animal products, such as meat and dairy products, as well as in processed and fried foods. When you consume high levels of saturated and trans fats, your cholesterol levels may increase, which can contribute to plaque buildup in your arteries. This plaque buildup can narrow your arteries, making it harder for your blood to flow, which can increase the risk of heart disease and heart attacks. Alternatively, a diet rich in fruits, vegetables, whole grains, and lean protein sources, such as fish and poultry, can help lower the risk. This type of diet is also low in saturated and trans fats, which can help improve cholesterol levels and reduce the risk of heart disease and heart attacks. In conclusion, by limiting your intake of saturated and trans fats and increasing your intake of fruits, vegetables, whole grains, and lean proteins, you can improve your heart health and reduce the risk of heart disease and heart attacks. Seventh is sleep deprivation. This is a major risk factor for heart disease and heart attacks. If you don't get enough sleep, your body releases stress hormones, such as cortisol and adrenaline, which can increase your heart rate and blood pressure, putting extra strain on your heart. Sleep deprivation can also disrupt the balance of hormones in your body, such as leptin and ghrelin, which regulate hunger and metabolism, which can lead to weight gain. In addition, sleep deprivation can also weaken the immune system, making it harder for the body to fight off infections and inflammation, which can also increase the risk of heart disease and heart attacks. On the other hand, getting enough quality sleep can help improve heart health and reduce the risk. Aiming for 7 to 9 hours of sleep each night and maintaining a consistent sleep schedule can help improve sleep quality. It is important to note that having one or more of these risk factors does not guarantee that a person will have a heart attack, but it does increase the likelihood. In conclusion, getting adequate quality sleep, maintaining a healthy lifestyle, including regular exercise, a healthy diet, and avoiding smoking, can help to reduce the risk of heart attacks. And finally, excessive alcohol consumption. This can have a serious impact on heart health. Here's 5 ways on how it can increase the risk of heart disease and heart attack. First, alcohol can cause an increase in blood pressure, which is a major risk factor for heart disease and stroke. Second, alcohol can stimulate the heart, leading to an increased heart rate, which can put strain on the heart and increase the risk of heart disease. Third, chronic heavy drinking can weaken the heart muscle, making it less able to pump blood effectively and increasing the risk of heart failure. Fourth, alcohol can increase the triglyceride levels in your blood, which is a type of fat that can contribute to plaque buildup in the arteries and increase the risk of heart disease. Lastly, alcohol can also interfere with the blood's ability to clot, which can increase the risk of heart attacks and stroke. It's recommended to limit alcohol consumption to less than 1 drink per day for women and 2 drinks per day for men in order to reduce the risk of heart disease. In conclusion, limiting your alcohol intake, or not drinking at all, is best for heart health. If you enjoyed watching, check out our other videos on heart disease and heart attacks, and don't forget to like the video, subscribe to our channel and hit the bell for instant notification of new videos. Thank you for watching.